A very good morning to respected delegates and co-participants. I'm Jaasminerjiit. I'll be presenting today on my research topic, public practices and beliefs concerning antibiotic storage, sharing and disposal among adults in life. Okay, so in general, antibiotics are medicine which are used to prevent and fight against bacterial infection caused by bacteria. Okay, penicillin use has been seen to increase from year of 2009 to 2010 by 10.5%, and there is misconception. This misconception has brought the public towards raising the antibiotic resistance. And in 2017, statistically, it was found that antibiotic resistance has become the primary healthcare concern in 21st century. There are about 700,000 people who has even died from antibiotic resistance each year because antibiotics was unable to resolve the infection secondary to ineffectiveness of the antibiotics for the particular infection use. Some doctors has even commented that Malaysians prefer to take antibiotic without even seeking medical advice from healthcare profession, which can lead to wrong antibiotic usage. The objectives of our study here today is to assess the relationship among understanding of antibiotic usage with the demographic factor, assessing the relationship between knowledge of antibiotic sharings, practice among demographic factor, determining the antibiotic storage among adults, and also determining the practice of antibiotic disposal among the adults. Okay. So the research question, the research here would like to find on the understanding of public on the storage, sharing and disposal of antibiotics. The finding of this study will be able to provide awareness to the healthcare professions and the needs to educate the patients on the antibiotics usage. And the public would also be aware on the practices on the antibiotics storage, sharing and disposal. This would also give up government to as a call to for the need to arrange for awareness campaign to combat on the antibiotic resistance. Okay. The study was a prospective study done descriptively with 300 sample size at the area of Negeri Sembilan using convenient sampling for 6 months from 1st of January 2019. Public that was taken into this study were those who understood Malay, Malaysian citizen and age above 18. And validated questionnaire was used for these studies, and the results of the study was analyzed using SPSS statistic data. So the questionnaire was designed and pilot study was done with 20 respondents, and Cronbach Alpha and internal Cronbach Alpha was done with results of 0.7 to validate on the adapted questionnaire. And the data collected was at the gatherings like gathering areas like shopping malls, food court, and supermarkets at Negeri Sembilan. Okay. So this study was able to find that there were more females compared to males in the study, and mostly were young populations, and also Chinese populations, and mostly were single young people who already completed their bachelor's in degree. This could be because mostly females love shopping, so probably due to that. And then young adults are found easily at shopping complexes, and mostly university students who has completed their bachelor's in degree. In terms of knowledge of antibiotics, around 50% respondent actually thought antibiotic is even effective against viruses. And mostly respondent with high level of knowledge was about 75 among the 300 sample size. The chi-square test was able to find two factors which was with significant results in comparison to the knowledge of antibiotics, which was race and education status. Okay, this is because education could enhance the knowledge on the antibiotics usage and practices. In terms of storage, mostly the public has answered on storing away from sunlight, and also they do not store most of the antibiotics. Okay, and the reason for it was so that they can use it for future. Okay, this could be because they were aware on the high temperature which affects the stability of the drugs. Okay, in terms of sharing, education status was one of the factors which was significantly related to the practice of sharing among family members and friends. However, 265 respondents do not share their antibiotics. This could be because education has improved on the knowledge on the of the public. However, the respondent who do share, the reason for that was so that they want to help the people who are in need. Okay. However, this can increase the risk of giving incorrect treatment. Okay. For the disposal of antibiotic, most of the respondents were aware on the unused antibiotics which was thrown into garbage and kept until it was expired. Okay. More than half of the respondents were aware of the negative impact on the environment. Okay. So we can conclude that education about handling the antibiotic should be given to patients by the healthcare profession, which will help in enhancing the improper handling of antibiotic. Okay, and it's also recommended to further studies in hospital and clinics so we could get the better results of the studies. So this is the reference used. Thank you for your precious time and attention.